Hi, everyone, and welcome to The Search Show, where we talk about current issues using common sense.
All right, so today I want to talk about the medical field. All right, I've traveled through America in many places. I've been through America in many places, worked in the medical field for a little bit. Um, and there are some good states, some bad states. Some places, some states take really good care of their elderly. Some states, they don't care. It's all about the money. Mostly it's all about the money because the medical companies just make it all about the money. So it's not about the human anymore. It's more about the cash. Ding, ding, ding. But I do want to talk about one state that it's just, to me, it's just amazing. Amazing how they rip off their own elderly people. And it's not just elderly, actually, it's anybody. So the reason I'm saying this, okay, and the reason I want to talk about it is because it's not about politics, it's about the cash. I don't care if you're Republican. I don't care if you're liberal. I don't care if you're Democrat or if you have no party. This is about the cash. So this is what happens. One day, whether you want it or not, you're going to get old. Or not even that. You may get to the car accident. You can fall and something may happen to you. Or, because of the COVID shots or any kind of other stuff that we're eating right now, you end up with some major issues with your health, and there is no cure for that, or there is cure, but it's very expensive, and you end up in a hospital for 3 days. After 3 days, they're going to kick you out because they don't want to keep you there because it's not beneficial financially for them. So they're going to send you either to a rehabilitation or to the nursing home. Now, if you go to rehab, let me tell you something. Please participate in therapy, get better, and get out. Because if you don't, there's only two choices: home, get out, or going to a nursing home. Now, nursing home, that's when the trap begins. All right, and why do I say trap begins? And I'm going to talk to you about California right now. So the trap begins in because when you go to nursing home, usually you have partial insurance that you pay on your own, and you be covered by Med-A. Med-A is actually covered by the federal government. So the federal government actually has a very, very good system set up for people, and they do care. They do want to pay for you. However, when it comes to MediCal, that's a different story, and I'll tell you why. So for Medicaid, the nursing homes usually will tell you, yeah, you're covered for 100 days. That's fine. Don't worry about it. So you keep your elderly there. Caution number one: make sure you are covered for Med A and B, which gives you 100 days, and then you can go on Med B forever. Or you only have Med A. That is a very, very big difference, because if you only covered by Med A, they only pay for 21 days. After 21 days, it's out of pocket. What I mean by out of pocket? Out of pocket means that you pay $400 a day for some crappy, shady place who only gives you a small broken table and a bed in a very tiny, maybe ripped off room, all right, where your roommate is you don't know who. So basically what it is, it's if they cover you for 21 days, the nursing home probably will not tell you that you only covered for 29 days. Now, if the nursing home tells you you only cover for 21 days, that's a very, very good and honest nursing place. And there are not many of them out there. Believe me. Most of them, they're going to tell you, oh, okay, you cover on the Med A. So automatically you assume that you covered for 100 days, and it's like, oh, okay, good. My parent or I or my family member can stay here, and they're in a very good hands. Well, no, make sure, and I'm telling once again, make sure you covered for 100 days, because if not, once again, after the 21 days, you're going to pay out of pocket. So out of pocket is $400 a day. All right. And unfortunately, for the $100 a day, you don't get much except, like I said, broken table, some bed. Somebody probably died on it. They just clean it up with Clorox, and then that's it. And they put another patient in there. You may get CNAs who literally don't care about life and about people, so they're gonna give you a hard time to even wipe your butt or give you even a cup of water, or they just ignore you, push the button, and walk out. Well, that's a kind of a common thing. Or, you know, you get a nurse that gives you an attitude because they have to give you pain medication. And sometimes, you know what, they don't even know what kind of medication they're going to give you. So you're going to have to check and be on your mind, in your mind, that, you know what, let me make sure that they don't give me medication that it's not on my list, that they don't slip in me the medication that, you know, a sleeping pill at night, so that way I don't bother them at night, they can take a nap. Or, you know, they give me laxative, so I go to the bathroom, and then that makes the CNAs angry because they always have to clean the patient, and that's why they're left behind, and your family member is left behind, or you, if something really bad happens to you, and you're just gonna be there in a dirty diaper and burned up, you know, skin because, you know, urine has not been cleaned for hours. So that's the worst scenario, which unfortunately I have seen. So I'm just warning you, make sure that the facility is really taking good care of their patients. Now, one way to tell you if it's a good facility is if you walk in and there are a lot of people outside sitting in the wheelchairs and roaming around. That means that the nursing actually cares. The CNAs watch the patients, and they let them move around, and they don't mind taking care of them. But if you walk in and there is no patient out on a wheelchair, and you are on the hallway, that's a warning sign. That means nobody wants to wash them, put them in the chair, and they're all in their beds just laying there, okay? And that's the sad part. But anyway, out of that, there are some really good nursing and nurses, so I'm not saying that everybody is the same, but unfortunately, there are very few to find. So, like I said, if you find a very good nursing home that takes very good care of your family, oh my gosh, you're a lucky person. But going back to the coverage. So if you want, make sure that you cover for 21 days, okay? Otherwise, it'll be out of pocket. And if it's out of pocket, you're going to have to pay them. Sometimes it's enough to be $16,000 or even more. So make sure, because I've been into one of the situations where a family member was never told that their loved one was in there, and that later on they had to pay $4,000 out of pocket at the end of the month. Now imagine a poor family who can barely afford anything, having the family member in there, and then if they want to take them home, they're literally being, bullied by the nursing home because they have a bill of $4,000 to pay before the person get out. Now, just to let you know, yes, you can get out. That's not a big deal. Take your family member out of there and just leave, and don't worry about paying the bill. I mean, I would say if you can pay, that'd be great, but don't worry, they're ripping other people off, so they're not going to be that bad off. But if you find a good nursing home, just be nice to them, pay the bill, and, so that they can be ensured that, everybody gets a really good treatment. Now, if you cover by the Med A and Med B, that's a very good deal, and that's the one that you want to be on because your family member is covered for the 100 days, and then if something happens, they can stay on Med B and the government pays for it. Now, the part with the 21-day coverage and another scheme is that in California, they will try to, and like I said, it's whether you're a Republican, Democrat, Libertarian, or you don't have no party, unfortunately, that awaits all of you, okay? It does not give you a difference whether or not, what party you choose. So choose wisely next time when you vote, because that will affect your future. But going back to the point, they're going to try to set you up for MediCal. And boy, MediCal sounds good. And MediCal is good. But it is good for the people who never worked, people who are on Medfare, okay, or Medicaid, people who literally have nothing. Because when you have nothing, the whole system is for free. And it's beautiful. But what gets me angry is that those people who never work, who live on the street, who come here illegally, who, just basically are in, criminals and all the other people, I call them the milk the system people. They know the system, so they'll get it free. They will get everything free. The doctors, the nursing, the meds, everything, it's free. And guess what? It is the responsibility of the nursing home, if they need to go somewhere, if they live on the street, to find them housing. So it's beautiful. MediCal is beautiful if you are poor and you have no money, and if you're illegal. But boy, it's so sad for the hardworking American who pays their taxes. Because if you're a hardworking American who pays your taxes and you have some money in a bank and you own a home, that's where the scam is. If you want MediCal, yes, you can go on MediCal, but they're going to take you home. They're going to take your bank account money. They're going to take your Social Security savings or your checks, and they're going to say that your checks will cover for everything and your money will cover for everything. So yeah, too bad for you who you work your whole life to put your savings away and to pay your taxes, because you're going to have to pay for your own insurance. You're going to have to pay for your own stay over there. You're going to have to pay out of your own money. And guess what you're going to get? $35 a month on your own spendage. I remember one time I literally wanted to cry because I had one patient who told me, he was a man, a hardworking man. He told me, he's like, I always had more than three jobs. I worked really hard. I pay my taxes. I put my money in the bank. For what? For this broken table? This is where I'm supposed to end up, so that all my savings go to this place? So the reason I'm talking about it is it's because MediCal, it's a big scam for people who working hard, who put their money in the bank, who have homes. And unfortunately, it is better not to have anything when you get old and literally be broke, okay, than to have savings for your future. Just FYI. I'm not saying don't have savings. I'm not saying, go on a system and milk the system. But those who milk the system, they know what they're doing. And unfortunately, it's kind of sad. So when you get old, it's better have nothing than to pay out of pocket for your own insurance and the same broken table that you're going to have with the person right next to you who has nothing, who is homeless or addict. And they're going to get housing, they're going to get home, but you're going to have to pay out of your own pocket to get a housing and get home. So yeah, that's my scoop on medical situation here in the United States and in California. For sure, it's a big scam. I've seen it. I've seen families literally selling their second homes just so they can pay for the elderly to stay in the same nursing home when their next next bed neighbor, I would say, their roommate is literally addict from the street, has nothing, is treated, and they pay $400 a day plus additional stuff and transportation, when the next, their roommate is getting everything for free and free housing. So yeah, that's the sad reality. And I think literally people, I don't understand how we can put up with that. I literally hope that, I never get old and get sick to be in one of those places. But let me tell you something. If I do, I think before I go anywhere, I'm going to donate everything I have and then make sure that they cover me for free. So anyway, but that's just my point on medical. At the same time, I do want to talk about nursing home care. Like I said, there are some places that are very good nurses, very good CNAs. But, make sure that your loved one is really taken care of, that they're not being abused, that they're not, and I don't mean abuse like hate or stuff like that, although sometimes it does happen, especially in Northeast area. I've seen that happen, and it's very hush-hush, and the older generation doesn't talk about it because they don't want to be retaliated against. But if, like I said, if you see people on the hallways, in the wheelchairs, moving around, there's life in the nursing home, then that's a good home. They actually care about their people because the people are out of bed. But if you go to a nursing home where there's no patients, or the people living in there roaming around, they're just all in beds and nice and peaceful, then I don't care how nice that place looks like, because it's not about how the place looks like, it's about the care. Then I would not put my family and loved one in there, because they're probably laying in bed and, everything looks beautiful on the outside, but their butts are probably rotting from crap that they're in and pee that they've been in there. So yeah, just letting you know, that's the reality. I'm not going to be, putting around, oh, how nice. And like I said, not all the places are like that. I've worked in some great places. And I always, when I see people and people talk to me, I always refer them to those facilities that are really, really good. I always tell them, okay, listen, this facility right there is amazing. This doctor is awesome. These nurses are great, but I do want to warn you about the ones that are not. So, yep, just let you know. And this is not political, this is just reality. All right. So I see you on my another topic. Thank you.